Howdy folks, it's Dr. Z returning for VEDA 2014, day 25, 5 days away from the end of VEDA. I'm at the Sullivan's Drugs over in Hillsboro, Illinois. This is a very caring and very personal pharmacy that caters to its patients as best as it can. My time here has been very rewarding and very personal as well, to try and develop that relationship with patients that I've been wanting from my previous experiences. That's what I kind of want to talk about today, the differences between independent pharmacy and retail pharmacy. They essentially do the same thing. They give the drug to the patient as prescribed by your doctor. And I've already talked about that whole process at the beginning of my series. But the main draw with retail is that there are a bigger variety, as well as, more often than not, cheaper prices. Sometimes independents can surprise you, but the main draw is that it's very accessible. They have multiple stores all over the area. CVS, Walgreens, Walmart are big names across the nation, as opposed to independents, which usually have 1, maybe 2, maybe 10 stores in the area. Another thing with retail pharmacies is that a lot of their processes are automated. You get the same service from store to store to store, whether that be good or whether that be bad. It's a lot more structured when you come in the door and drop off your prescription versus once it gets out the door. One of the major downs of being in retail is that you may or may not be able to develop that relationship with the patient, because most often you're dealing with a lot of prescriptions within one day. Sometimes that's not the case. Independents can also drive a lot of business. More often within retail, there are other programs that they're working with, such as calling patients, calling doctors, calling insurances. Those automated calls that you see as well come from the staff in the pharmacy. That can eat up quite a bit of that day. Another thing about retail pharmacies is that their services are usually farmed out to a central location, more often to help improve their workflow, their profits, because they centralize their filling, they centralize their calls, so that way it decreases the amount of work that the on-site staff will have to do. However, that allows for more work to be done by the on-site staff, which could mean that you're still not getting that much contact with patients on the floor. A lot of what I experienced in retail is by simplifying the workflow that you have with traditional roles to be able to expand into more unconventional roles. But even doing so focuses your work even more so on the traditional role, because that's where their trends and how they analyze your work come from. It's how are you building your business in the most conventional way. When it comes to independents and how they work with their patients, a lot of it deals with the service and the connection that you have with these patients. It's less about the filling and less about the traditional roles that you have within the pharmacy. In an independent pharmacy, it's a lot more personal and especially patient-focused, where a lot of the services you provide and a lot of how you are practicing in pharmacy are based on the relationships you have with person to person, rather than standardizing everything you're doing to make sure each patient is treated the same. You're actually focusing on treating each person as who they are. Someone who is having a hard day at work and just needs to get their prescriptions because they have something that they need to rush to for that night. Or someone who's completely sick and doesn't want to be sitting around in a pharmacy for 10, 15, 30 hours on end. He just needs to get home so that way they can just rest up. Each of these people with each of these different situations, at least in an independent way, you're more focused on them to make sure that they are getting the service that they need to live a better life. Another aspect about relationships is more than just the patients. It's also the relationships you have with your doctor. In a retail setting, you have automated services that contact doctors on your behalf, and then they automatically, in electronic ways most often, send you the request or send you the responses that pop up in your computer, and then that computer takes care of it for you. Whereas an independent, they're less likely to have that, and more often than not have to call out and reach out to them in person, by phone, calling the doctor and say, hey, this person needs a refill. Nurse checks the patient chart and says, yeah, it looks like it's time for them, and they've been seen just recently. You know, it's a lot more of a personal connection than the cold, hard refill request. The other thing about independent pharmacy is that you more often see that patients and pharmacists are more willing to work with you. It's back to that relationship, but it's more than just a patient-pharmacist relationship. It's a business relationship. I'll help you here if you help me there, and you're working back and forth so that way both people are getting a mutual benefit. If you can't pay now, that's fine. We'll set up a charge account and make sure that when you are able to pay, you can pay them. Working things out, more so than in a retail setting where it's like, if you can't pay for it, leave, or go to another pharmacy, or wait until you can, but I'm not going to give you anything. It's a lot more, it's not cold. Because honestly, there are humans who work there. I was a human who worked there. It's not a lack of respect, but it's a lack of trust. In an independent pharmacy, you're trusting more because you're developing that business relationship, whereas in a community setting, it's more retail. It's a lot more like McDonald's. You expect a service, you get the service, or you don't. Unfortunately, that's just how it is. What I've seen between the two worlds, it's basically two sides of the same coin. On one side, you're both treating patients, you're both giving medications, you're both contacting doctors. But on one side, you're working out a business, helping one side to help another. It's a lot more personal. It's a lot more face-to-face. It's a lot more of a community feel, as opposed to retail in the community, where it's a lot more standardized. It's a lot more focused. It's a lot more working things out in unconventional ways. It just depends on what kind of person you want to be. Retail is a great setting for a lot of people, especially one where you get in, you know what you're going to deal with, and then you get out and hands-on. In an independent world, it's a lot more focused on how you're working from day to day to day. What you do today will affect how your business will work tomorrow. These are things to think about when you're looking into your future. So that's it for today. Leave me in the comments about which side of pharmacy you practice in, or which side of pharmacy you receive your prescriptions in, and why. As a request from a friend, I decided to make a special video about a topic within pharmacy. That's something that I've been wanting to develop for quite a while. It's just a little time intensive, but still something worth it. So once it's available, it'll pop up in here. Until then, like and share my videos, subscribe to my channel, and I've been Dr. Z. Have a great night.